Welcome to the Behind Beliefs and Behaviors podcast, where we take you on a journey of what is behind the specific beliefs and behaviors that impact individuals and organizations. With our guests, we get to the root cause of what stands in the way of everything from health, wealth, and relationships to leadership, community transformation, and societal progress. From topics on leadership, psychological safety, corporate culture and communication, to parenting, trauma, relationships, personal health, and intimacy, this podcast is sure to get you to the source and provide you practical tips to transform your life one root cause at a time. I am your host, Dr. Maisha Claiborne. I'm a physician, a coach, a consultant, and an expert in trauma-informed communication. The founder of the Mind Remapping Company, I help individuals and organizations better understand the brain, behavior, and the root of false beliefs so that you can more effectively listen, communicate, connect, and create fulfilling relationships and results in your personal and professional life. Join us every Monday morning at 8 a.m. and let's get to the root cause and discover what's behind your beliefs and behaviors. Welcome back to another episode of Behind Beliefs and Behaviors. If y'all don't know, I'm Dr. Maisha, and I am so excited for today's conversation. I got a sister on here that we've been in each other's circles for several months, maybe even longer, because time is elusive for me. But from the moment I connected with her virtually, I was like, I must meet this woman. And we actually had an opportunity to meet in April. At the time of this podcast, we're recording in July. So we met a couple of months ago, and her energy was everything that I knew it would be. And we've had a few conversations. So she's like my fast growing friend. And also she's just a beautiful soul. So today we're going to be talking about psychological safety in the fertility journey with Dr. Erica Bove, who is the CEO and founder of Love and Science, Thriving Through Infertility. She is a fertility specialist and a fertility coach. And I am super excited. I think this is such an important topic. So welcome, Dr. Erica, to the show. How are you?
I'm great. Thanks, Dr. Maisha. And I wholeheartedly agree. We are two peas in a pod. When I met you, I was like, I need to connect with this woman. I need to get to know her, be friends with her. We're already colleagues. And the more I exist in this world, the even more connections I see between us, among us. It's such a beautiful community that you've cultivated. And I'm so grateful to be in your circles. Yes.
Yes, I appreciate that. Well, I know you, but I love for my audience to get to know you. So would you mind just formally introducing yourself, letting the audience know who you are, what you do, and how you came to this space?
Absolutely. So my name is Dr. Erica Bove, and by training, I'm a double board certified OBGYN and fertility specialist. The fancy name for that is reproductive endocrinology and infertility specialist, because we do more than just fertility. And I've been in practice a while now. I guess I'd be considered mid-career at this point. And I was, going about my days in my clinic and really realizing that professional women, especially physicians, were just not getting what they needed in the space of the clinic visits. And, if you think about it, when you're a fertility specialist, if people are successful, they move through the process fairly quickly, right? They have their initial visit, you figure out what they need, then they get pregnant, they graduate, and all is well. But the more and more I got into this, I realized what I do day in and day out when I'm not in the OR is I delve in bad news. Like I help people navigate unexpected outcomes and additional challenges to their fertility journey that they might not have expected or anticipated. And that's really hard stuff. And so as I was doing my own personal work in my own life with parent coaching and relationship coaching, I was like, you know what? I think coaching actually has what my patients need to help them bridge the gap to feel more confident in their decisions and their process, navigate the bad news, and ultimately get to a successful outcome.
Yeah, I love that. And I think it's a thing that not often people think about as part of this process. In my experience, when families are going through this fertility process, they go to the doctor, they do a thing, and they either get good news or bad news, and they're having to manage it internally or within the family unit on their own. And
Yeah.
to have someone as holistic as to not only help them to take them through their fertility journey from a physician, from a medical side, but also from a more holistic, emotional, psychological, dare I say, spiritual
Yeah. It's a
side.
spirit. Yeah,
I don't think that,
totally.
yeah, I mean, because I really don't think that, there's a separation. I mean, you're going through this journey, it can be quite a spiritual experience.
It is a spirit, and then I do like, I have a rich spiritual life, and I draw upon that all the time. I always ask my patients and my clients where they're at in that, because
Mhm,
I think that
mhm.
when we can bring in that dimension, it changes everything. And so
Yeah.
when I saw the connections between what I was learning in my own personal coaching, I was like, I think I want to become a coach. So I went
Mhm.
to coaching school. This We are all lifelong learners, which is
Yes.
wonderful. And so I did that in 2021. Did a 6-month program with tuition and night classes and everything.
Mhm.
And then I decided to found Love and Science, which is primarily for female physicians going through the fertility journey. And
Mhm.
usually the people who find me are people who have not yet been successful and are
Yeah.
like, you know what, this is harder than I thought it was going to be. I
Mhm.
really need some additional resources because I'm overwhelmed, I'm hopeless, I feel powerless, and this is taking over my life. And so what I really wanted to do is create a safe space for these women to hold them, to hold their experience, to allow them to process their feelings, and
Mhm.
not just individually, but also in community, because that's a really important aspect of what we do for people who want it. We can share in a group, and just those meetings, I leave them with my heart just on fire, because I'm like, you know what? This is the most powerful work I can imagine for me on this earth.
Yeah. You know what? You brought it up. I want us to talk about this idea of this safe space, of cultivating this safe space. And I'm gonna disclose. I speak from what I feel is a place of privilege in the realm of the fertility journey. I didn't have my son came unexpectedly,
Yeah.
beautifully unexpectedly at the age of 39. When I actually thought I might not have kids, mostly because I didn't have a solid partner,
Yeah.
right? And
Right.
so I was like, "Oh, well, I guess if I don't." And I know not many people have that perspective or have that kind of thought process. But I did see a lot of women in my private practice when I was in integrative medicine who were seeing fertility specialists who were going through their fertility journey and coming to me for adjunct like acupuncture to help
Mhm.
boost that process. And so I would love for you to talk about like what normally happens. What is the because I think that it's important for audience to feel seen and heard, and to get audiences who don't get it to get like what normally happens in this journey that feels unsafe for people to be able to process throughout that time.
Uh, yeah, thank you so much. And that's wonderful that you have that experience. And I will just hold space for your experience. I think you have your beautiful child that also comes with some trials and tribulations as well. And so this is the thing. I lean on Glennon Doyle and her wisdom. I think we're all humans trying to have a human experience. Sometimes I
Mhm.
just say, hey, don't mind me. I'm just humaning over here.
Yeah, I love that. I love that.
And I take lessons I've learned from my own divorce, because I did not have a fertility journey per se either. There are aspects of things that definitely resonate with me in terms of the struggles that my patients and clients face. But
Mhm,
I think when we can take the fact that the human experience does entail suffering, it does entail some element of isolation, it does entail fear, anxiety, all those things. And how can we hold space for that as humans? And
mhm.
so that's the place that I come from.
Yeah.
So, what happens basically if somebody is intentional and really desires to build a family from the place of like, okay, I'm stopping my birth control, we're going to do this, we're going to try. Typically, it can take a little bit of time for people to get pregnant. I think that social media makes people think that nobody struggles, which is
Mhm,
just one of my PSA. I like
mhm.
to let everybody know that that's not the case.
Yeah.
1 in 6 couples has infertility, and 1 in 4 female physicians. Think about that. 1 in 4 female physicians has
Wow.
infertility. That's
Wow.
huge
That's
number. And
huge.
most of us are like a little bit type, a little bit on the like to have our ducks in a row, and don't like surprises, don't like the things that we can't control.
Mm.
And we have this thing I call doctor brain. So like our doctor brain keeps us in the doctor brain driver's seat and has a really hard time flipping over and being a patient. It's like almost like a fence that you're not supposed to cross in some ways. I think we could do better in terms of our training, but that's just how most of us are raised in this medical culture, is that we're really not supposed to be patients. And if we are, there's something really wrong. So just thinking about that context, I think, is really important. So say somebody's been trying for 6 or 12 months or even longer. Sometimes people wait longer to come and see us, and they say there might be something going on here. Usually the first step is meeting with a reproductive endocrinologist like myself. It's usually about a 45 to 60-minute appointment of going through the history. And some of the questions are invasive. They ask about the things you put inside your body, like substances. They ask about sexual practice questions. And a lot of those, like, we don't usually share that information with people like widely. Those are very personal questions. So just understanding that there's already some like probing and some vulnerability even in that first appointment before anything's even happened.
Right.
So that's the starting place, is like meeting with a reproductive endocrinologist. And then, once the physician hears the story, it's like, okay, these are the things that I think we should probe in terms of tests to help us figure out where things might not be connecting. Right. If somebody's in their late 30s, early 40s, I usually think, okay, well, maybe age is playing a role here in some way. It's usually not, infertility is usually not like one giant thing. It's usually a bunch of little things that line up to keep people subfertile. So I think of myself as like a detective. I have my detective hat on, my glasses, and I'm investigating to try to figure out what's going on. So a person then invested about a month in this testing, which is usually some combination of blood work and ultrasounds, and even that dreadful HSG, which is the fallopian tube test, where it's quite painful. It can be, to see if the fallopian tubes are open. And then they come back for that second visit to be like, okay, what do the data show? And what is the diagnosis, right? So of all the different things, sometimes people aren't ovulating. Sometimes there's a sperm issue. Sometimes there's a blocked fallopian tube. Some women have fibroids inside their uterus. Sometimes it's more than one thing. But actually, Dr. Maisha, like 30% of the time around that, there's not a diagnosis that's found. It's like, oh, you have something going on, but you have what we call unexplained infertility. And like, especially women professionals, like my physicians, my engineers, that is like very unsatisfying. It's wait, I'm here because it's been 18 months and you're telling me you can't figure out what's going on. It's like, well, we have treatments for that, but I can't tell you exactly. So already there's this like, okay, well, like I'm a patient. I either have a diagnosis, which I can hang my hat on. Okay, I'll have to assimilate that. That takes a process of understanding, okay, like I thought everything was fine and it's not. Or this very unsettling, like, I know something's going on because we're not pregnant yet, but there's nothing this like in medicine, we're taught problem solution. If you just try hard enough, you'll find a diagnosis. That's what I learned in medical school, is very clear cut, but the world is not like that, especially in what we do. And so it's like trying to assimilate that diagnosis. And then among that diagnosis, that context, being offered different treatment modalities that might be able to help. So sometimes it's as straightforward as helping somebody ovulate better, or maybe concentrating the sperm and putting it inside, which already, even if it's like our minimal invasive stuff, is like, okay, now you need to rearrange your schedule. Now you need to come in for an ultrasound on this specific day. And you need to either have intercourse on this specific day or come in for an insemination on this specific day. So some of my patients and clients are like, wait, I'm in the operating room that day. I'm rounding. I'm on all these different, it takes some kind of like, that's the first attack, I think, is like, oh my gosh, my schedule is not my own. My life is not my own. And then trying to figure out how to balance being a fertility patient, which often includes like many of these ultrasounds and blood work sessions in the mornings. And sometimes like, oh, and by the way, you can't travel. And oh, by the way, you can't do XYZ. You can't exercise like you used to. So it's like a real adjustment of like, well, this is how I thought I was going to be just swimming along with my life, but I have to change a lot of significant things to be able to follow my instructions and do this process.
Wow. Listening to you describe that process, I can feel in my body a little bit of tension and anxiety. I can't even imagine what that must feel like to someone who's actually, or to a couple even, that's actually going through the journey. And so I imagine that This is why what you do as a coach is actually so valuable, because all of that, the tension building up in my body, it's 100 times for the people who are experiencing it. And then not being able to like talk through that and work through that, like that can be
Yeah.
super stressful. And we know stress can impact fertility in and of itself, right?
Yeah.
That constant hypervigilance, fight or flight, sustained release cortisol is impacting the body's ability to settle and to relax, to be able to go through that process
That's
in
right.
its most workable form.
Yep. And it's that, you're right. It's the stress. And it's hard because we can't really measure stress. So people ask me all the time, does stress affect the fertility process?
Mhm.
We all believe it does.
Yeah.
It's really hard to measure stress. It's really hard to treat stress. I mean, there's been some
Mhm.
acupuncture studies, but that's really where I come in, as I try to understand that and try to provide that safe container for people
Mhm.
and calm the nervous system, work through the feelings when triggers happen, as they commonly do in this process. Like, we haven't even talked about all the news that can happen. Okay,
Oof.
you've done your third cycle of XYZ, your pregnancy test is this date, and then you're hoping it's positive. But even in vitro fertilization, sometimes the best we do is 50-50. It's like one of these things where you really do your best, and
Mhm.
we as humans are still so inefficient that even when we're doing every single thing we can,
Yeah.
there's still a very good chance that there's going to be disappointment at the end of that news. And
Yeah.
helping people even get through that 2 week wait of like, okay, you've done this intervention, you've put all of you've given up your autonomy, you have
Mhm.
done all the things. And then that's this, that spirituality, right? That we talked about before, is like,
Mhm.
how do you surrender to the process?
Yeah.
Because I think that a lot of this is energetic vectors, truly.
Ab
And I say we need all your vectors lined up in the right direction for this to happen. And so much of that is like hoping that it's going to happen and then letting go of the outcome. To me,
Yeah.
that's the sweet spot. But you need
Right.
a very safe space. We cannot surrender unless we feel completely safe.
Yeah. Yeah, it's really interesting because I've seen this over and over again, where I've had patients, I've had friends, and especially physicians who have gone through these processes and failed multiple times. And then they're like, you know what? This is it. I'm just gonna, if it's not this, then I'm hanging it up. And it's that letting go of the outcome, then
Yeah.
suddenly it works,
Isn't
right?
it why and we've seen this
I don't.
fight. Yeah. And even there's a study, and this isn't the same exact thing, but that people who even make an appointment with a fertility specialist have a higher rate of conception. Like, I can't
Mhm.
tell you the number of times that people will fall off my schedule, and it's because they have a positive pregnancy test, but it's higher than you'd expect based on that patient population. So you're like,
Mhm.
there is something about saying like, this is not in my control entirely. I
Yeah.
need help. It's like that 12 steps, like, right? The first
Yeah.
step is you
Yeah.
recognize that you're powerless,
Yeah.
and then that turning over of it
Mhm.
in some way allows things to work. And I think of that as being receptive, being open. But I do think, and this is, there's no blame, there's no, in terms of our own processes, but we're so complicated. And I think we do all have a lot of blocks in the system. And part of it is
Mhm.
to figure out, like, where is the energy blocked? How do our limiting beliefs play a role in that? And how can
Mhm.
we recognize those and reframe and turn it over?
I love that. I absolutely love it. Let's talk about how feeling safe with your doctor like impacts the experience, because this is a space where you're coaching and this is an area of expertise for you, like that, making it safe for couples to disclose, to like process.
Yeah, I mean, I think it's such a great question, because in terms of having a successful outcome, ultimately, there's so many things that go into that. There's sort of, what decisions do we make at various points in
Mhm.
time when things aren't working? There's even the sheer like sticking with the process. There's a lot of dropout in this process because it's so emotionally taxing. It affects individuals, it affects couples. And so from the beginning, whenever I meet a person or a couple, I'm like, I need to know who you are. I need to know what makes you tick. I need to know what your values are. Some people, they meet with me and they're like, you know what? Like, for various religious reasons, we would do these sets of treatments, but not these. And I say, thank you so much for telling me. That's really important to know, because
Mhm.
then I can understand that person in the context of their culture and their beliefs and all those things. And so that initial relationship, I say, listen, like, this is going to be a journey. Like, there's going to be good news, there's going to be bad news, there's going to be periods of waiting that are going to seem intolerable. And I'm your girl. Like, like, I'm here for you through the ups and the downs. And like, we need to start off strong. And if for some reason, like in the context of that first appointment, it doesn't feel like a good connection, I
Mhm.
encourage people to find their person, because
Mhm.
that foundation is super important. And that foundation with the REI, the fertility specialist, that
Mhm.
connection also with the nurses, because the nurses do a lot of communication, really making sure, at least in the medical space, that there is a trust. Because a lot of this, especially like for female physicians, is like, well, I know so much about cardiology or ICU care, but this is so far out of my wheelhouse. So you
Right.
really do have to say, like, well, I know I'm a physician if that's a person I'm working with, but I trust that this person knows what they're doing. They know the data
Mhm.
and they know me as a person, and they're
Yeah.
going to be my guide. Because sometimes there's not, like, this is clearly the right next step. It's
Right.
like, of these options, what's the next right thing for you? And that's a
Right.
very different question.
It really is.
Yeah.
I'm gonna tell you what I most love about what you said is you getting to know who the patient is first, like
Yeah.
what makes them tick. And as you described the process earlier on, you were talking about when this first visit, there's a lot of invasive and really probing type questions. And I think that when you lead in with, I want to get to know you, I want to get to know what makes you tick, and pre-framing the ups and downs, and like, but you're not in this alone, like
That's
I'm your
right.
girl, like that is that framing of that first encounter is everything. And I think that what it does is it creates expectation for the
Yes.
process itself,
Yes.
and it gives like a semblance of structure and control where there is none, like
Yes.
control within the not the be it not uncontrol, I guess you could say, right?
That's right.
So that's
That's
I
right. And I
love
talk
that.
about that. I thank you so much for highlighting that. I actually bring the serenity prayer into pretty much everything I do. And I say,
Mhm,
okay, there's like different buckets here, right? Like, so we say, God or
mhm,
higher power, whoever it
mhm,
is that we're reaching out to, love, grant me the serenity to accept the things I cannot change, the courage
mhm.
to change the things I can, and the wisdom to know the difference. And my goal as a coach and as a doctor too, but like primarily my coaching role, is to give people back their agency.
Yes.
However, I always say we have to identify which bucket is this in? Is this okay, you're
Mhm,
44 years old. Can we control that? No. But like,
mhm.
maybe you have excellent insurance and you have different options within that. So it's always like, for me in my personal life, I create so much suffering when I mix those buckets up with each other, right?
Mhm,
So it's like,
mhm.
okay, how can we say, what bucket is that in and where does your agency lie? And a lot of times is in your work, a lot of our agency lies in our thoughts
Yeah.
and our framing of things. However,
Mhm.
we need a safe container. Otherwise, none of this works.
Right, right.
Yeah.
Absolutely. Context, framing. I love that you brought the serenity prayer in. And because that's one of the things that I've used for years.
Really?
And
Tell me, I
this
want to
the
know.
girl, the wisdom to know the difference. Woo!
Yeah. Yes.
That's the piece.
That is the
That is
piece.
the piece. That is the piece.
That is the
Oh,
piece.
oh my goodness. And so what are some of the challenges that as a coach that you face? I'm curious about, I mean, getting the journey and how you provide safety and provide a container for your clients. I imagine it must be incredibly challenging for you as a coach to hold that space. How do you take care of yourself? I'm curious
Oh,
about
yeah.
that.
Yeah, I think all of this work requires like rigorous self-care. And so I think I've learned, like, I'm my own sort of temperature sensor at this point. And even if I'm like 1 degree off kilter, I sense it and I'm like, okay,
Mhm.
what do I need? Like, do I need a little more sleep? Do I need a little bit more better nutrition? Do I need to go for a run? So I have like my own like sleep. I sleep 7 to 9 hours a night. That is one of my, like, if I'm giving a talk the next day and I don't feel like it's up to snuff, I say, you know what, this was my best. I'm not going to lose
Mhm.
sleep and say I'm going to get 5 hours of sleep to put something together, because
Mhm.
that to me would be abandoning myself. So I'm very conscious that this work takes a lot of empathy. It takes a lot of holding space for other people. And I can only do that if I'm have my well filled and if I walk the walk myself, right? So
Mhm.
sometimes we do the next right thing in our groups, and I share, I say, okay, I'm going to be accountable to you guys as well. Like, this is my next right thing, is to journal or to do whatever.
Mhm.
And so I have, since college, I've had my stool with my 4 pillars. One is good nutrition, one is exercise, one is relationships and spirituality, and
Mhm.
the other one is sleep. And so that's taken different forms over time, especially as I'm a mother myself. So sometimes you hope for 3 of the 4, but just being really like plugging in every morning, meditating every day for at
Mhm.
least 10 minutes. I have my Chopra app, which I adore. And just in me realizing like I am not alone, right? That's when
Mhm.
I get in trouble, is when I think, oh, this is all up to me. I'm alone, blah, 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 whatever my own limiting beliefs are. And I think,
Mhm.
like, no, I have my higher power. I have my amazing community of friends and colleagues and family who I've cultivated. And my experiences, right? So drawing upon my own experiences. But it does take saying no to something. If it's like a
Yeah.
request of something I even want to do, but I just know I
Mhm.
don't have it in me. Sometimes I have to be honest and say, like, that's that people pleaser. Like, I want to, but now is not
Mhm.
the right time.
Right, right. I asked that question because I think you model what you're teaching
Yeah.
clearly. And I think it's good for people who are going through the fertility journey or any health journey or any journey to really get like the self-care, especially if you're holding space for others. The
Mhm.
self-care has to be in place. Your own container has to be in place. And I have a similar process to you. I get up in the morning and do gratitude journal. I was at the Entre MD live this past weekend,
Oh,
and added a practice because one of the things I have to be accountable for is recording and recognizing and acknowledging my wins,
mm,
acknowledging when I do well. Because I am a go, just be in the process. I'm just in the process, head down. Like that's what I do. And then I tap out and I'm like, what do I have to show for it? But I do have things to show for it, right?
yeah.
And so I think that having this process of making sure every day I write down, oh, this is the win for today.
Mhm.
And this is what I'm grateful for. So in the morning it's gratitude, in the evening it's wins. And then I take time for meditation. My yoga is like the container for my day. The martial arts is the back end container. And then my time with my son is non-negotiable, right? So I
Yeah.
carve out that time. And so it's in order to be able to give, we have to pour into our own cups. And I think for people going through this journey of fertility, they have to remember to be intentional about pouring into their cup.
Yes. Yes, and we actually talked about this on Friday night at our support group. This was the topic, is how
Mm,
do you get what you need and make fertility just a part of the story, not the
mm,
entire story.
mm,
And one of the members just said, like, who's looking out for numero uno? And she said, like, and really modeling for the group, like how she has been able to, in 2 to 3 months, take fertility, which was just in the forefront, all she thought about. Oh, I have to do this paleo diet. Somebody in a holistic space actually told her that certain activities would negatively affect her uterine lining. And again, this is the hard part. We talk about separating fact from fiction, because
right.
a lot of people have opinions about things that aren't necessarily grounded in science. But every single movement she made was just being so controlled by, like, oh, but maybe this is, and that's that self-doubt you talk about in some of your other
Mhm,
podcasts as well, is like, okay, so how can we be confident in our values, confident in our decisions in a way that allows us to live this life? And really, a lot of it is making sure that we pour into ourselves for
mhm,
many reasons, right? Because it calms our nervous system, it gives us gas in the tank, it helps
mhm,
us weather bad news, it helps us make decisions,
mhm.
and ultimately do what's going to be best for ourselves. But when we don't do that, right, we're coming from a place of scarcity, a place
Yeah.
of fear, and we're not operating at our highest frequency. And so I think that affects many things. It affects the quality decisions we're able to make. It affects our self-concept. It may even affect success in terms of like, I see my clients and patients who are really doing this, they really tend to do well over time. And again, it's tricky because with fertility, you can never guarantee, oh, this transfer is going to work, et cetera. But it's a larger view of trusting the process, because sometimes it's, you know what, I've done 3 IVF cycles with my own eggs. Maybe it's time to think about other options. And that's not right for everybody. But if you have your well full, it at least allows you to entertain possibilities and say, could this be for me? Maybe it's not for me, and for what reasons? And what do I really want? And we can't even ask ourselves that question if our well is empty.
That's right. It's like it gives us access back to our thinking brain. Rather than making decisions from scarcity, we're making decisions with a well full and from possibility.
That's
and
right.
in the work that I do, we say perception is projection. When we're in that scarcity and we're perceiving the scarcity, that is the I can only think about, or I have to, or I need to, or like everything, just what you were just saying, like centered around. And it's such a tricky and delicate thing, because people all the time say, well, just stop thinking about it or stop worrying about it and it'll happen, which a person who's in that position can't do. Right?
That's
Like
right.
you
That's
know, like
right.
not naturally. It's like, what are you talking about? That's it. It borders the line of gaslighting. And then the tricky part is there's a little bit of science to that, right?
That's right.
Is that it has to be framed in a particular way. But like that perception being projection is when we begin to, because the unconscious mind doesn't recognize the negative, and the unconscious mind will put out whatever the energy is and give that back to you. So when we're from scarcity, number one, it's impacting our stress response. It puts us in that fight or flight. It increases that cortisol, which we've already said earlier, impacts our capacity to be able to our body to be able to work in a way that makes this process effective, that makes this journey effective. But when we begin to be in that more of that abundance and that acceptance and that commitment without attachment, it settles the nervous system, it settles the glitter, and it lowers that cortisol. So then it does allow the body to be able to accept what's coming and be
That's
in
right.
that energy. So I love that you said that having that well full.
That's right. And I have 2 follow-up thoughts about that. I think that some people come to me and they're like, Dr. Bove, I'm doing all the things. I do my yoga every day. I do my acupuncture. I do my supplements. But the energy is so tight and so like fearful that it's almost like there needs to be a shift of like, maybe less is more. Maybe filling the well is actually 2 hours of unscheduled time where you wander through a field and don't just check off the acupuncture. And this is nothing against acupuncture, but it's like sometimes people come to me and they are doing all the things, but it's from this like scarcity mindset. And so I think it's really, that's where the coaching comes in, is like, what energy am I coming from? What thoughts do I have that are fueling this? And maybe even though it looks abundant on paper, maybe it's actually coming from a scarcity mindset. So that's, I think it's a really subtle thing to pick out. I think another thing that I thought when you were speaking about the abundance is sometimes we live in a certain geographical location and maybe reproductive services are limited. I mean, if you look at a map of clinics in the country, there are places, especially in the West and the South, that are really underserved. And so that mindset of like, well, maybe I can think outside the box geographically. Maybe I'm not, if this relationship with my fertility doctor doesn't feel amazing, there is somebody out there for me. I just need to find them. And again, that comes from a place of privilege and people need to be able to travel and access resources. But I think most of the people who we interact with maybe have those abilities, but it doesn't even come through the radar because all the fear centers are firing, or people don't want to like, oh, well, I don't want to offend anybody. And it's like, this is not the time to worry about offending. This is the time to take care of numero uno and find out a way authentically to get what you need.
Absolutely. Absolutely. Oh my gosh. There's so many directions that this conversation could
I
go. And of
know.
course, it's like,
I know. It's almost time. Can I ask you one question? One more
yes,
question.
Yes.
So one thing I see in my clients so much, especially my physician clients, is this hypervigilance. And
Mhm.
we know that hypervigilance is part of trauma, and that part of it is like calming the nervous system in a way that we're not hypervigilant. How
Mhm.
do we engage with a system that is sometimes broken and
Mhm.
also tamp down that hypervigilance? And maybe you were like, oh, I was hoping you would answer that question. We can talk about it. But from your experience, because this is what you do, right? You do like trauma
Yeah.
and psychological safety and all those things. I
I
think
do.
one thing I love about your work is it's not like, oh, you need to reframe your thoughts and feelings only. It's like individual and system wide. And that's how it has to happen. So that's a question that is always top of mind for me. And
Yeah.
I wonder what lens you could bring to that.
Well, I think that when we're looking at this lens of trauma, we have to examine what is the belief and what's underneath the belief. So if the belief is, I can't have what I want, then what's underneath that? When's the first time that you've heard that? What and who told you that? And what experience or experiences have led to that feeling in your body? And once we can begin to really examine that and the emotions that come with that, right? Because trauma is not the event itself, it's what happens to the body as a result of what the event that may have happened or the experience that may have happened. So when we start to tap into the emotions that are connected with the deeper beliefs and the pain, the hurt, the anger, and we begin to release those at a subconscious level, then it allows us to recognize that a thing happened without it having a grip on us and determining the belief system itself. And once we can let go of an old, what I like to call an old lie, right, an old lie about ourselves, then it leaves a blank space for us to create something new. What
Hmm.
do we want to believe? What we know to be true about ourselves, about our own worth, about our own resilience, about our own intelligence, about our own capabilities, about our own beauty, about our own whatever it is. And that's what settles the nervous system,
Hmm.
releasing the negative emotion. So that's a lot of when I do deep release work, that's a lot of what I focus on is releasing the negative emotion that's attached to whatever the belief may be. And of course, from a systemic standpoint, there's a lot of work to be done to be able to cultivate a system that doesn't traumatize
Yeah.
patients and doctors.
Yes.
You
Yeah.
know,
Thank you for saying that. Yes.
yeah. From
Yeah. Because
person
I
to
think you're
person.
right. You can say, like, oh, go ahead. Please go ahead.
Oh no, I was just saying from person to person, it just needs to be dismantled. But go ahead. Yeah.
That's right. No, saying like, I can navigate a broken system.
Yeah.
Like even something like that, like I acknowledge the system is broken. Maybe that's something that's outside of my control. As the communication is not optimal. I
Yeah.
can stay grounded. I can do what I need. I can tune into my intuition of what feels right and not. And I understand this is suboptimal, and I'm going to do my best in the
Yeah.
context of the
I
system.
can advocate for myself. I
Yeah,
can say
that's
what I
right.
want and say what I need. I deserve that.
That's right.
There's another belief is undeserving, right? I
Yes,
deserve to be able to have my voice heard. I deserve to be loved. I deserve to be respected. I can stand up and advocate for myself and say what I want. And how we do anything is how we do everything. So when you can get that you deserve it in your personal life or in your professional life or with your doctor, then you begin to believe I deserve in all realms. I
that's
deserve
right.
to have to be a mommy or to be a daddy or to be a parent.
That's right.
Right? I deserve that.
That's right. Thank you. That was so
Mhm.
beautiful. And I'm going to carry that with me as I continue to coach and I continue to doctor and as I continue to human.
That's right. That's right. Yeah.
I
I
deserve that.
deserve it. I
Thank you
deserve
for
that.
that.
You deserve to be able to be human. Yeah.
That's right.
Yeah. Yeah. Well, oh my God, this is such a rich conversation. We may end up having to have a part two.
Yes. Yes.
I
Yes.
can see
Yes.
it.
And I'd
I
love
see
to
it.
have you on my podcast too, Dr.
Oh,
Manisha. That would be
thank
so
you. Thank
lovely.
you.
Yeah.
Well, I want to make sure that our audience knows how to reach you. How can they reach out to you if they want to work with you, if they want to invite you to speak to their organizations, because you do that, or consult, or whatever it is the case may be? Where do they go?
Yes. So my website is the most comprehensive place. It's loveandsciencefertility.com. Through that, people can book a free discovery call if they are interested in working with me. I try to streamline everything. So my email is loveandsciencefertility@gmail.com. Just send me an email if you are interested. Also, I have social media on Instagram and Facebook under the same name, and LinkedIn as well. So I love to collaborate. I love to connect. This is my passion. And so let's all continue making this world a safer, more loving space to be.
Yes. So go and check out Dr. Bove.
Yes. And my podcast, which you will be on. I now have the podcast, which is just beautiful. I love it. I love that creative energy. I love thinking about what will benefit the world. And that's a wonderful space, as you've created this space to share that kind of inner world.
Thank you. Yes. Yes. So and the name of the podcast?
Love and Science Fertility. It's all very consistent. Yeah.
I love it. That's a brilliant branding.
Thank you.
So
that's what I say when I do my embryo transfers, right? I say it takes love and science. And so when I was thinking about what I wanted to name this space, I thought that it takes both. And so let's honor that.
Both. Yeah, I love that. I love the honoring of that. And so we will have all of this information for the audience listening in the show notes and in the description. If you're watching on YouTube, go and visit Dr. Bove on all of her social media profiles, Love and Science. And we look forward to this being one of many conversations for sure. And of course, always to the audience, thank you for listening. Without you, there is no podcast. Share this episode. Make sure you share this episode. This is such an important conversation. Remember to subscribe and listen, leave a review and let us know what you think of this episode, Dr. Bove. Make sure you're passing her on to many people. So thank you again, Dr. Erica. I so appreciate you. And to the audience, until the next time, stay empowered.
Thank you for listening to our podcast. We know that without the listeners, there is no podcast. We hope you enjoyed this episode. Please remember to subscribe so you do not miss when we drop our next episode, and share this podcast with a friend, a family member, and a colleague, at least one person in your life today. This episode was brought to you by the Mind Remapping Company, helping organizations create psychologically and emotionally safe cultures that make their employees and leaders feel seen, heard, respected, welcome, and valued, all while fostering a thriving, engaged, and healthy workforce for the organization. Is your organization in need of a speaker? I speak about topics like psychological and emotional safety, trauma-informed communication, and employee well-being. If this is aligned with your organizational inclusion, belonging, or leadership goals, contact me, Dr. Maisha, by going to www.mindremappingacademy.com. That's mindremappingacademy.com. Finally, we train leaders, but we also train coaches. If you're interested in becoming a trauma-informed coach, visit our website as well and check out our NLP coach trainings and certifications. We'll see you on the next episode. Until then, stay empowered.